So today we'll be discussing diabetes. By way of definition, it's a metabolic disease that has to do with the body's inability to produce enough or produce any insulin. Insulin is needed for the body to be able to absorb glucose. This will ultimately lead to elevated levels of glucose within the blood. And there are different types. There's type 1, I'll come to explain later. There's type 2, there's gestational diabetes mellitus, and there's pre-diabetes. Currently, at least 1 out of 3 people will develop the disease in their lifetime because lifestyle is changing, diets are changing. So most people that will continue with this downward trend of unhealthy diets and lifestyle, sedentary lifestyle, high glucose containing meals that are not the healthy fibers, they're at risk of developing diabetes. So 1 in 3 people would ultimately develop diabetes in their lifetime. Now, type 1 diabetes is also known as insulin dependent, but is also known as juvenile diabetes mellitus. It's usually diagnosed in children and young adults less than 30. And this happens when the body's own immune system destroys the parts of the body that produces insulin. So the insulin producing cells of the pancreas is called beta cells. So there's a kind of autoimmune condition that can mobilize the individual's own innate immunity to destroy these beta cells. Once it's destroyed, the body would lose the ability to produce insulin. As such an individual would need exogenous insulin to be able to absorb glucose. Only about 5% of people have juvenile diabetes mellitus, which is insulin dependent diabetes, in which the only drug they can survive on is insulin, not tablets. So in these individuals, the body does not produce insulin at all. It is not preventable because there's no known primary cause or primary intervention other than the fact that the body's immune system would, through some multiples and very varied factors, can induce an autoimmune disorder that would then destroy the beta cells of the pancreas. So what are the causes? Predisposition to diabetes is genetics, and sometimes some viruses have been alluded to be a cause for this type 1 diabetes mellitus because they would alter the inflammatory reaction, they will alter the immune system. The immune system in confusion will then target the beta cells and destroy it. So what are some symptoms of diabetes? The common symptoms will include excessive thirst and appetite. They're always thirsty, they're always hungry. Increased urination, it could be as often as every hour. For those who have uncontrolled diabetes or those who have not been placed on medication, then they could have unusual weight loss or weight gain. Weight loss many times will be because they're losing a lot of glucose. Weight gain, if they've been placed on insulin, they will have an unusual weight gain. Then fatigue, they're always tired, they could be nauseous, some of them could vomit, blurring of vision because diabetes would ultimately come to destroy the retinal cells. Then in women, they could have frequent vaginal infections, notably yeast infection. Then in men and women, they could also have yeast infections. Then dry mouth because they're losing a lot of fluid, so they are dehydrated, the mouth feels dry, they always want to drink water. Then when they have wounds or cuts, it doesn't heal quickly, then they could have itchy skin, especially in the groin and the genital areas. Many times this is from the yeast infections. So type 2 diabetes, usually this can develop at any age. But the problem with this condition is that the body cannot use insulin properly. Most of the cases of type 2 diabetes mellitus can be prevented, and it's about 90% of all cases of type 2 diabetes. It used to be called adult onset or non-insulin diabetes mellitus, but now it's just type 2 because sometimes it's not an adult that will have that, it could be a young adult. Now the body produces insulin, but the body does not use it properly. So glucose does not move into cells, they just pile up in the bloodstream. And sometimes when the individual will have the symptoms, that should be a suspicion and alarm for them to go check it out. They could take it for granted. Frequent urination, tiredness, weight loss, and things like that. Patients could explain it away when this disease could have been discovered earlier. So what are the risk factors? Genetics is a prominent risk factor. If there's a family history of type 2 diabetes, there's a high chance that an individual could develop it. Then family history, polycystic ovarian syndrome. Now, polycystic ovarian syndrome, because of the hormonal interplay of the female hormones, this could also impact the insulin and its effects. But these ones will usually have irregular menses. Then race, African Americans, Hispanics, and Asians would have it more than whites. I'm talking about type 2 diabetes. Then the age, after 45, it increases. The usual age of onset is after 45, but now it's increasing even in younger adults and children because of a change in lifestyle. Then some environmental factors like inactivity, those who live sedentary lifestyle, and those who have gained a lot of weight, they're also at risk of developing type 2 diabetes mellitus. Now, gestational diabetes mellitus simply means gestation is a state of pregnancy. So having diabetes during pregnancy and during pregnancy only. If an individual had diabetes before pregnancy, it's no longer gestational diabetes mellitus. That could either be type 1 or type 2, based on if the person depends on insulin for survival. But for GDM, it is diabetes during pregnancy only. And this is common in people who have a family history of diabetes, people who are overweight prior to their pregnancy. Now, having diabetes inside pregnancy increases the chances of the individual developing diabetes later on, in this case type 2 diabetes, and giving birth to a baby greater than 9 pounds, which is greater than 4 kg, also puts the individual at risk of developing type 2 diabetes. And 18 out of every 100 pregnant females will develop gestational diabetes mellitus. So what are the major complications from diabetes? They have wounds in the foot that do not heal, that leads to amputation many times. Diabetes could also affect the heart with narrowing of the vessels, of the coronary vessels, and a diabetic patient is at risk of myocardial infarction and so many other coronary heart disorders. Then it could also damage the retina, which can ultimately cause blindness. Then damage to the kidney. Diabetes on its own can cause stroke. Now, the 5 areas that are majorly affected by diabetes are the brain, the kidneys, the heart, the peripheral vessels, which especially on the lower extremities, those vessels could become damaged, such that when an individual sustains a wound, apart from the fact that the intrinsic healing function of a patient with diabetes is compromised, the peripheral vessels that have been compromised again also impedes the healing, and you could have gangrene that would necessitate an amputation. Then of course the eye, it could lead to blindness because of affectation of the retinal vessels. So how do you monitor diabetes? It's simple. A blood sample is taken and put on a test strip like this type. For an individual who is diabetic, it's advised they have a logbook to keep track of their glucose. It helps them keep track. It also helps the managing physician to keep track of how controlled this BP is. The better controlled this blood glucose is, the better controlled the blood glucose is, the least side effect and complications to be expected. The more poorly controlled it is, the more side effect and complications that should be expected. So what's the target? The target fasting blood glucose, if it's normal, should be 70 to 100 before meal, before 10 a.m. After meal should be 70 to 140. Now, an individual who is pre-diabetic could have 101 to 125 You would not say the individual is diabetic yet, but you could very well say he or she is warming up to it. So that would be the time to really do a lot of lifestyle modification to bring down these numbers. Then after meals, they could have between 141 and 200, at which you suspect something is going off with the way the body is metabolizing glucose, with the way the body is producing insulin, and a couple of other things. Then diabetics, their fasting will be greater than 125 before meal if it's fasting. After meal, they will have greater than 200. Now for places where the units that is applied is millimole per liter, you will just divide this value by 18 and it gives you the target reading that an individual will be aiming to get. So how do you prevent? Type 1, we already said type 1 is not preventable because it's an autoimmune disorder that could be induced by viruses, could be induced by genetics, and a host of other complex things. So there's no definitive preventive measure for type 1 diabetes mellitus. However, for type 2, the primary prevention is to maintain a healthy lifestyle, increased activity, exercise, moderate weight, healthy meals, high fiber diets, reduce consumption of refined sugars and the likes. So the secondary prevention is to check the HbA1c and adjust. And your HbA1c will average the blood glucose of an individual over a span of 3 months. And it measures what percentage of the hemoglobin is coated with sugar. So someone who has a lot of excess glucose floating around within the bloodstream will have excess glucose, excess sugars also coating the hemoglobin. So their HbA1c levels will be normal, will be high. So someone with a normal HbA1c levels will have 4 to 5.6. Pre-diabetic will have 5.7 to 6.4%, and diabetic will have greater than 6.5. So even someone who is not diabetic, who has no challenges, HbA1c ideally is one of those general checkups that someone of age would want to see. You want to check to assess, okay, in the past 3 months, what has been the level of my HbA1c? What's the percentage of my hemoglobin that has been coated with excess sugar? Then tertiary prevention will be exercise and eating well. Foot exam has to do with someone who is already diabetic. This will prevent and reduce chances of them having undiagnosed, undiscovered leg ulcers, which can progress very quickly and very badly to become gangrenous, necessitating an amputation. So now, how can someone prevent gestational diabetes mellitus? There are two components: physical activity and diet. A pregnant person, other than the fact that the person would also aim to be of a moderate weight before getting pregnant. Now, when they're pregnant, they're encouraged to be very physically active because researchers have found that being physically active before and after their pregnancy will reduce the risk of having GDM by about 70% or even more. So a sedentary lifestyle in pregnancy is a no-no. Then diet, having a diet that is high in fiber has a highly protective effect against gestational diabetes. It's been said that 10 grams of fibers a day can reduce the risk of GDM by as much as 20%. So you see, it's something that is quite preventable. Now, global prevalence for the different continents of the world. It will interest you to know that Southeast Asia, West Pacific, these two continents have the greatest prevalence of diabetes. But then to our beloved Africa, we have about 22 million. But I must say we are also beginning to warm up because we are majorly beginning to adopt Western lifestyle and Western diets. So now on pre-diabetes, I already told you the glucose readings that is expected that will make you suspect could this individual be pre-diabetic. The HbA1 reading that is expected that could make you suspect that an individual is pre-diabetic. 86 million people are said to be pre-diabetic. That's more than 1 out of 3 adults. And now 9 out of 10 of these 86 million do not even know that they are pre-diabetic. Why? Because many people are not having some checkup done. So without weight loss and moderate physical activity, 15 to 30% of these people will go on to develop type 2 diabetes within 5 years. So pre-diabetic was the prevention program. Lifestyle intervention, which is the lifestyle modification versus a medicated group versus a placebo group. It was found that of these three groups that research was carried out on, 3,243 participants were found to be overweight and they had pre-diabetic. Now, lifestyle intervention, lifestyle modification, which is exercise, weight reduction, high fiber diet, and a couple of other things, reduce their diabetes by as much as 58%. Metformin, a drug that is given to diabetic patients, reduced it by only 31%. So which would you rather go for? Someone who is pre-diabetic should just adjust the lifestyle that led them to being pre-diabetic in the first place. So in summary is that type 2 diabetes can be prevented or delayed with activity and diet in a pre-diabetic individual. So someone who is pre-diabetic, what can they do? They can prevent or delay type 2 diabetic by losing weight, eating healthy, being more active. And someone who is already diabetic can manage their own diabetes by working with a healthcare professional. It's not something you can manage in isolation. While you have a good understanding of it, for a patient who is diabetic, it still needs to be correlated with a health personnel who puts them through, would adjust the dose of the medications as the need may be. Then, of course, eating healthy is essential, and of course, staying active. Thank you very much. So you can write your questions in the comments. Have a wonderful day.